all fat are not equal. So all fat cells are not the same. Fat cells in different parts of the body behave differently. Some of the fat cells under the skin are meant to persist for a longer period of time. So it doesn't matter how much you diet, some fat is going to stay around because they were meant naturally, evolutionary wise, they were given to us so they could be there when one day we're in the middle of a desert, in the middle of a famine, then they would feed us at that point. Unfortunately, in modern life, they become a little bit of a nuisance and we sort of want to get rid of them. And those are the areas we target with liposuction. Now, we know that subcutaneous fat is different than the fat that is inside of our gut or visceral fat. Visceral fat technically is deep to the abdominal muscle and is basically around the gastrointestinal organs such as your stomach and intestine. There's a blanket of fat that is meant to cover those organs in case of an infection or trauma. This blanket can also become large and big if one puts on a lot of weight. This fat, unlike the subcutaneous fat, tends to be a little bit more responsive to weight loss. But the problem is that when it does become larger, people feel that sometimes maybe they need plastic surgery, and those people actually will benefit more from lifestyle modification and weight loss. Plastic surgery is more directed at people who have subcutaneous fat in excess. So that's fat that is between the muscles of the abdomen or muscles around your waist or muscles of our arms or thighs and the skin. That is what's called the subcutaneous fat. And that fat also tends to be different in different people. In men, in certain areas of the body, that fat tends to be more fibrous. Many times we have to do some other treatment to get that fat to become somewhat softer. One of my favorite procedures for that is Visceral or ultrasound-assisted liposuction. So those are some of the things that are good to keep in mind if you're considering having liposuction.